everyone, and thanks for listening today. This is the RX Daily Dose. Today's episode is being recorded on Friday, January 3rd, and I'm your host, Ian Parnagoni. We update this podcast every week for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all of your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. I hope everyone had a good holiday season. Now, as we all know, it's back to reality, unfortunately. We do have multiple updates for you since we were last on, so let's get right into it. On December 19th, the FDA approved Ervebo, the first approved vaccine for the prevention of Ebola Virus Disease, caused by Ebola virus in individuals 18 years of age and older. Cases of Ebola virus disease are very rare in the United States, and those that have occurred have been the result of infections acquired by individuals in other countries who then traveled to the United States, or healthcare workers who became ill after treating patients with Ebola virus disease. Ebola virus disease is contagious and is transmitted through direct contact with blood, body fluids, and tissues of infected wild animals or people, as well as with surfaces and materials such as bedding and clothing contaminated with the fluids. Onset of symptoms of EVD can be sudden and can include fever, fatigue, muscle pain, headache, and sore throat. This is followed by vomiting, diarrhea, rash, impaired kidney disease, and liver function, and in some cases, internal and external bleeding. EVD has an incubation period that ranges from 2 to 21 days. Individuals who provide care for people with EVD, including healthcare workers who do not use correct infection control precautions, are at the highest risk of infection. Confirmed outbreaks of EVD have been documented since the 1970s. On rare occasions, though, people become sick with EVD after coming into direct contact with infected animals, which can then lead to EVD outbreaks when the virus spreads between people. An outbreak in 3 West African countries from 2014 to 2016 resulted in more than 28,000 cases of EVD and more than 11,000 deaths that were caused by Ebola virus. The Democratic Republic of Congo, the DRC, is currently experiencing the world's second largest EVD outbreak. In 2018, the World Health Organization and the DRC began to use Ervebo as an investigational vaccine under an expanded access program to help mitigate this outbreak. With or without vaccination, it is critical to implement appropriate infection control and prevention measures as part of efforts to prevent the spread of EVD. The approval of Ervebo is supported by a study conducted in Guinea during the 2014-2016 outbreak in individuals 18 years of age and older. The study was a randomized cluster vaccination study in which 3,500 contacts and contacts of individuals with laboratory-confirmed EVD received either immediate or 21-day delayed vaccination with Ervebo. This noteworthy design was intended to capture a social network of individuals and locations that might include dwellings or workplaces where a patient spent time while symptomatic, or the households of individuals who had contact with the patient during that person's illness or death. No cases of EVD with symptoms greater than 10 days after vaccination were observed in the immediate cluster group, compared with 10 cases of EVD in the 21-day delayed cluster group. The safety of Ervebo was assessed in approximately 15,000 individuals in Africa, Europe, and North America. The most commonly reported side effects were pain, swelling and redness at the injection site, as well as headache, fever, joint and muscle aches, and fatigue. Ervebo is administered as a single-dose injection and is a live, attenuated vaccine that has been genetically engineered to contain a protein from the Zaire Ebola virus. The approval of Ervebo was granted to Merck & Company. Also on December 19th, the FDA approved olaparib, going by brand name Lynparza, for the maintenance treatment of adult patients with deleterious or suspected deleterious germline or somatic BRCA mutated advanced epithelial ovarian, fallopian tube, or primary peritoneal cancer who are in complete or partial response to first-line platinum-based chemotherapy. Lynparza was originally approved in January of 2014 for ovarian cancer. Patients with BRCA mutated advanced epithelial ovarian, fallopian tube, or primary peritoneal cancer should be selected for therapy based on an FDA-approved companion diagnostic. Approval was based on a randomized, double-blind, placebo-controlled, multi-center trial that compared the efficacy of Lynparza with placebo in patients with BRCA-mutated ovarian cancer, fallopian tube, or primary peritoneal cancers, following first-line platinum-based chemotherapy. Patients were randomized 2-to-1 to receive Lynparza tablets 300 mg orally twice daily or placebo. The trial demonstrated a statistically significant improvement in progression-free survival for Lynparza compared to placebo. The most common adverse reactions of any grade occurring in patients who received Lynparza in the study were nausea, fatigue, abdominal pain, vomiting, anemia, diarrhea, upper respiratory tract infection, and constipation. The recommended Lynparza dose is 300 mg, that's 2 150 mg tablets taken orally twice daily with or without food for a total dose of 600 mg. On December 20th, the FDA granted accelerated approval to Enhertu. Its chemical name is FAM trastuzumab deruxtecan NXKI, for the treatment of adults with unresectable or metastatic HER2-positive breast cancer who have received 2 or more prior anti-HER2-based regimens in the metastatic setting. Enhertu is a human epidermal growth factor receptor 2, that's HER2, directed antibody, that's the same as what's in Herceptin, and a topoisomerase inhibitor conjugate, meaning that the drug targets the changes in HER2 that help the cancer grow, divide, and spread, and is linked to a topoisomerase inhibitor, which is a chemical compound that is toxic to cancer cells. HER2-positive breast cancer is a type of breast cancer that tests positive for a protein called human epidermal growth factor receptor 2, which promotes the growth of cancer cells. Approximately 1 of every 5 breast cancers have a gene mutation in the cancer cells that makes an excess of the HER2 protein. HER2-positive breast cancers are an aggressive type of breast cancer. Enhertu's approval was based on the results of a clinical trial enrolling 184 female patients with HER2-positive, unresectable, and/or metastatic breast cancer who had received 2 or more prior anti-HER2 therapies in the metastatic setting. These patients were heavily pre-treated in the metastatic setting, receiving between 2 and 17 therapies prior to receiving Enhertu. Patients in the clinical trial received Enhertu every 3 weeks, and tumor imaging was obtained every 6 weeks. The overall response rate was 60.3%, which reflects the percentage of patients that had a certain amount of tumor shrinkage with a median duration of response of 14.8 months. Enhertu was granted accelerated approval, which enables the FDA to approve drugs for serious conditions to fill an unmet medical need based on the result that is reasonably likely to predict a clinical benefit to patients. Further clinical trials may be required to verify and describe Enhertu's clinical benefit. The FDA granted this application breakthrough therapy designation which expedites the development and review of drugs that are intended to treat a serious condition when preliminary clinical evidence indicates that the drug may demonstrate substantial improvement over available therapies. Enhertu was also granted Fast Track designation, which expedites the review of drugs to treat serious conditions that fill an unmet medical need. This application was approved 4 months prior to the FDA goal date, and the FDA granted the approval of Enhertu to Daiichi Sankyo. On December 23rd, the FDA approved Ubrelvy, going by brand name Ubrelvy, for the immediate treatment of migraine with or without aura in adults. Ubrelvy is not indicated for the preventative treatment of migraine. It is the first drug in the class of oral calcitonin gene-related peptide receptor antagonists approved for the acute treatment of migraine. Migraine headache pain is often described as an intense throbbing or pulsating pain in one area of the head. Additional symptoms include nausea, vomiting, and sensitivity to light and sound. Approximately 1/3 of individuals who suffer from migraine also experience aura shortly before the migraine. An aura can appear as flashing lights, zigzag lines, or a temporary loss of vision. Migraines can often be triggered by various factors, including stress, hormone changes, bright or flashing lights, lack of food or sleep, and diet. Migraine is 3 times more common in women than in men and affects more than 10% of people worldwide. The effectiveness of Ubrelvy for the acute treatment of migraine was demonstrated in 2 randomized double-blind placebo-controlled trials. In these studies, 1,400 adult patients with a history of migraine, with and without aura, received the approved doses of Ubrelvy to treat an ongoing migraine. In both studies, the percentages of patients achieving pain freedom 2 hours after treatment and whose most bothersome migraine symptoms stopped 2 hours after treatment were significantly greater among patients receiving Ubrelvy at all doses compared to those receiving placebo. Patients were allowed to take their usual acute treatment of migraine at least 2 hours after taking Ubrelvy. 23% of patients were taking a preventative medication for migraine. The most common side effects for patients in the clinical trials reported were nausea, tiredness, and dry mouth. Ubrelvy is contraindicated for co-administration with strong cytochrome P450 3A4 inhibitors. The FDA granted the approval of Ubrelvy to Allergan USA. Also on December 23rd, the FDA approved Lynparza, going by brand name Dayvigo, for the treatment of insomnia in adults. Dayvigo will be available in 5 mg and 10 mg tablets only after the Drug Enforcement Administration actually schedules the drug, which is expected to occur within 90 days. Dayvigo is an orexin receptor antagonist. Its approval is based on 2 phase 3 studies, Sunrise 1 and Sunrise 2, that included approximately 2,000 adult patients with insomnia. Investigators assessed Dayvigo versus active comparators for as long as 1 month and versus placebo for 6 months. In these studies, Dayvigo significantly improved objective and subjective measures of sleep onset and sleep maintenance compared with placebo. The medication was not associated with rebound insomnia or withdrawal effects after treatment discontinuation. Previously reported data showed that Dayvigo was effective in male and female patients and was well tolerated by both sexes, and that the medication did not impair postural stability and driving performance. Also on December 23rd, the FDA approved lumaterapone, going by brand name Caplyta, for the treatment of schizophrenia in adults. The approval is based on results from 2 placebo-controlled trials that showed a statistically significant separation from placebo on the positive and negative syndrome scale total score. In these trials, the most common adverse reactions for the recommended dose of Caplyta versus placebo were sedation and dry mouth. Pooled data from short-term studies revealed similar outcomes between Caplyta and placebo for fasting glucose, mean changes from baseline and weight gain, triglycerides, and total cholesterol. Furthermore, the incidence of extrapyramidal symptoms was relatively similar versus placebo. Although the mechanism of action for Caplyta is currently unknown, its efficacy may be mediated through a combination of antagonistic activity at central serotonin, that's 5-HT2A receptors, and postsynaptic antagonistic activity at central dopamine D2 receptors, according to the release. Intracellular Therapies expects to initiate the commercial launch of Caplyta in the first quarter of 2020. The drug is being further developed to treat disorders beyond schizophrenia, including bipolar depression, behavioral disturbances in patients with dementia, depression, and other neurological and neuropsychiatric disorders. And that's all I have for this week. I hope you enjoyed today's episode. I'll include all links and resources in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you listened to today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. I hope you enjoy the rest of your day. Music by Joseph